Hey everybody, I'm Morgan. I'm a nurse practitioner here at National Allergy and ENT, and I'm going to be discussing some of the epinephrine auto-injectors that we use in a case of an emergency, such as anaphylaxis. So typically you have three different options that your provider may prescribe for an allergic reaction that is severe, like anaphylaxis. So one of the most common ones that you may have heard is an EpiPen. So an EpiPen is epinephrine, and it comes in a form like this with a pen. Very simple to use. Now keep in mind this one does not talk to you, and the instructions are listed on the back. So in case of an emergency, you would pull this blue tip off. I like to say to use a swing action whenever you're going to the thigh, just so that you know that you're going and you're going to get the medication in the right place. So pull the blue tip off, swing to the outer thigh, you'll hear a click, and then you'll hold in place for about 10 seconds. And then once it's done, you'll release and the needle will retract. Okay, so most EpiPens or AVQ or the generic epinephrine auto-injector, the time limit may vary between 5 to 10 seconds on how long you need to hold in place. So make sure you read that on the instructions. That way you know how long you need to hold that in place so that all of the medication is dispensed and you're going to get the full amount. Okay, so the next epinephrine auto-injector that we have is just epinephrine. It's an auto-injector that you may pick up at the pharmacy. So this one will come in this case. Most do come in cases. So this one just comes open. Then you'll have the actual pen here in this form. So with this one, you are going to pull this off here from the bottom, pull it off on the top, and it's easy because it has the directions and it's labeled 1 and 2. So you'll know what order to go in. You'll use that same swing action, so swing to the outer thigh. You won't hear a click for this one, but then you'll hold in place as well for however long is indicated on the box. So this one was just a generic epinephrine auto-injector. Okay, so the last epinephrine auto-injector that I'm going to show you is an AVQ. So this is one that is actually a cartridge. The first two were pens, as you can tell here. This one is good to carry in your pocket, in your purse, and it's just a little bit of a different shape. So this injector will actually talk to you and walk you through each step as well during the emergency. So whenever you pull this off,
this trainer contains no needle or drug. If you are ready to use, pull off red safety guard.
So you'll just pull this down.
To inject, place black end against outer thigh, then press firmly and hold in place for 5 seconds.
So then you will do the same swing action to the outer
inject,
thigh.
Place black end. 5, 4, 3, 2, 1. Injection complete.
So with this one, whenever you are done, this will beep and let you know that all of the medication has been administered and you can release the injector from the thigh. Now it's important to note whatever injector you have, it's the same medication. If you ever need to use this medication in an emergency, you always need to make sure that you go to a local clinic or the ER to make sure that your reaction is resolving, it's getting better, and that you do not need more medication. So never just use this and then stay at home. So you'd want to seek further help. So if you feel like you need any of these medications, if you have any questions about any of these medications, or how or when to use these medications, don't hesitate to give us a call and we'll get you an appointment scheduled with one of our providers. Thanks for watching.